Case numbers for the COVID-19 pandemic are down this summer, but the devastation the pandemic wrought on immigrant communities in San Diego is still very much being felt. Hamadi Jumali, the executive director of the Somali Bantu community of San Diego, can hear it in the voices of the people who call him at all hours, looking for help in a desperate situation.
I think in the community, a lot of the community doesn't know their rights, because it's very few knows that this is my right. And with working with the community, we are educating the community.
Help is out there, thanks to a steady stream of federal and state funding to stave off evictions, help people make up lost income, and get utility bills paid. But connecting these communities to help in languages they actually understand has been a challenge after such a chaotic year. While Jumali takes these types of emergency calls as part of his regular job, he's now joined by over 24 other crisis counselors, part of a project that began in March from the San Diego Refugee Communities Coalition, Cal Hope Counseling Project, and the United Women of East Africa. The project came together after a study found immigrants in San Diego were 3 times more likely to be unemployed than other San Diegans.
We know that the pandemic was hard on everybody, right? Things like increased anxiety around constant health monitoring, loss of jobs, the physical isolation from support systems and communities. But we also noticed when we did this impact report that there was, that we know intellectually that this pandemic has impacted the refugee and new immigrant community more than the general population.
Claire Enemark is helping to lead this program, which uses federal emergency money to train crisis counselors who can speak with immigrant communities in their own languages. Right now, help is available in 18 languages. Immigrants can call a single number, then get put through to someone who speaks their language.
Our program is really unique. One of the main aspects that makes our program unique is it's a peer-based workforce. So we have 25 community support navigators who themselves are refugee and new immigrants. So they have this lived experience of surviving the pandemic, right, as we all have, but they have survived the pandemic with this unique experience.
Flyers advertising the program have been distributed at immigrant-owned marketplaces throughout City Heights, and its number has been shared on WhatsApp message groups, all trying to reach the community where it's at. The hope is that the counseling program meets all the needs of people at the moment of crisis, acknowledging that a financial crisis can easily segue into one involving someone's mental health.
One of our community support navigators a client reached out to her, said that he needed some help in paying his utility bill. He wasn't able to pay his utility bill. So she said, absolutely, connected him with the SDG&E rate reduction program, helped him sign up and apply for that, helped him kind of translate because it wasn't accessible in his native language of Arabic. And in that process, he opened up to our community support navigator that his wife had died of COVID just a few months earlier. And because he had felt, because of all of these existing community, there was a lot of mental health stigma. Had our staff not been providing some of that essential practical support up front, he might not have felt comfortable opening up.
For Jumali, who's already been doing this work for years, he's just happy to see there's a new generation of peer counselors getting trained. What he wants to see the most, though, are mental health professionals and social workers coming out of the community.
With the next generation, we want to make sure that we have our psychiatrists, we have counseling in our community, because we feel like community members need people that they speak their language.
The program is slated to run through the fall. Its leaders hope that further funding allows for the program to continue as long as the mental and financial impacts of the pandemic are still being felt. Anyone looking for help can call 888-222-0980. Max O'Flynn Adler, KPBS News.